initiation of drug use, but also delaying in drug use sometimes as well.
Thank you, Doctor. Mr. Chairman, I'll yield back.
Gentleman yields back. Chair recognizes Representative Ocasio-Cortez from New York for 5 minutes.
Thank you so much, Mr. Chair, and thank you, Dr. Gupta, for testifying before the committee today. And thank you for your tireless commitment to ending the overdose crisis, which has devastated so many families across the United States. ONDCP holds a unique position within the federal government, coordinating across 19 federal agencies and overseeing $41 billion as part of a whole-of-government approach to address addiction and the overdose epidemic. In addition to that, ONDCP's unique structure also enables it to be both nimble and comprehensive in its response to the addiction crisis. Dr. Gupta, how does the ONDCP utilize its unique cross-agency structure to effectively combat the addiction crisis?
Thank you, Congressman, for that question. We utilize the ability to have both drug control budget, fund control notice, as well as the ability to work through policy, implementing and making sure that the drug control strategy is implemented across all 19 drug control agencies. And really the coordination is so critical in this area when 109,000 Americans are dying a year.
Mm-hmm. And for emphasis, since releasing the 2022 National Drug Control Strategy, what are some of the successes of the ONDCP's whole-of-government approach?
So on the treatment side, we've seen more naloxone or Narcan get out there, 37% increase in prescribing, while 12% reduction in price. It will go over the counter in the upcoming days to weeks to months. We've seen expansion of treatment, making sure that telehealth provision happens, making sure that more removal of exfil with the support of Congress we've been able to do is to expand treatment providers from 129,000 to almost 2 million now. We've seen that more resources, $86 billion in this, $83 billion in this administration, 42% over the previous administration go into local communities. At the same time, we've seen having more seizures at the border, but understanding the problem doesn't begin or end at the border, working across the entire global supply chain as well.
Fabulous. And are there any changes the committee should consider making through the ONDCP reauthorization process to improve the office's ability to coordinate drug control policy and action across the federal government?
Thank you for that question, Councilwoman. I think it's important that as we move forward that we allow more ability for getting better data as well as being more proactive in emerging threat. The fact is today, not even 5 to 7 years ago, the threat we face with synthetic compounds, not just in the United States but across the globe, we're going to have to be more nimble but more proactive. And those aspects will allow us to do that, to remove less of the bureaucracy, more of the actionable parts that have more return on the taxpayer dollars.
Okay. And just to put a finer point on what you just shared, when you talk about getting better data, what does that look like? What are the levels of data that you all seek in order for us to make sure that we properly address that?
Well, thank you, Congressman, for that question. The fact is that over 20 years today, with this crisis, 100,000 people dying, we still don't have real-time data of overdose and non-fatal overdoses. We know for every fatal overdose, there are 14 potential non-fatal overdoses. Mm-hmm. We do this with heart attacks, we do this with strokes, we do this with so many of the diseases. It's important to have that data so we can get people the help that they need sooner than wait for them to die.
And so it's my understanding that currently you all do not have, and consequently we, do not have real-time data on overdoses happening in the United States, including non-fatal overdoses. Wow. Okay. With that, I yield back to the chair. Thank you very much.
Would my friend yield?
Absolutely.
First? I thank my friend. Just clarify, Dr. Gupta, because you were